So in this last section regarding H. pylori infection, we'll be studying about the different treatment modalities we can offer to a patient with Helicobacter infection. So in this section, we'll be studying about the primary treatment regimens and then the different secondary and rescue treatment regimens. What exactly is rescue treatment regimens? The resistance and the reinfection of H. pylori infection, and lastly, we'll be studying about the prevalence of Helicobacter pylori infection. So the treatment is usually in concordant with the USA. It is usually recommended that Helicobacter pylori infection treatment regimen include 2 antibiotics and a proton pump inhibitor for up to 10 to 14 days, for almost 2 weeks. The patients are usually counseled to choose an optimal 2-week period to maximize the compliance. So a patient is usually supposed to be taken the antibiotics for almost 2 weeks without any gaps in between. And the patients are also counseled to expect almost a few adverse effects such as diarrhea or cramping within the abdomen. And the standard treatment cure of the Helicobacter pylori infection is that around 80 to 95% of individuals are completely eradicated with this infection due to by following this method of antibiotic use. So now if we talk about the primary treatment regimens, the first is the triple therapy, which is the proton pump inhibitor with an addition of the clarithromycin, amoxicillin, which are taken twice a day. It's taken for 10 to 14 days, like we mentioned before, and the eradication rate is around 70 to 85%. And then there's a triple therapy with an additional metronidazole. Proton pump inhibitor, clarithromycin, metronidazole, each taken twice daily. And metronidazole is being replaced with amoxicillin, and the duration is around 10 to 14 days. And then there's a sequential therapy in which proton inhibitors and amoxicillin are being taken for almost a week, 5 to 7 days, followed by proton pump inhibitors, clarithromycin, and nitronidazole for 5 to 7 days, each taken twice daily. This is also taken for 10 to 14 days in total. And then there's a quadruple therapy in which proton pump inhibitor is given twice daily with an addition of bismuth salicylate, metronidazole, and tetracycline, which are given 4 times daily, as the therapy implies quadruple, so it's given 4 times daily. So all these therapies and regimens are given for almost 10 to 14 days. Patients are counseled to be taken these antibiotics for almost 2 weeks. The eradication rate of triple therapy is around 70 to 85%. And the eradication of triple therapy with metronidazole is similar, 70 to 85%. Sequential therapy has an eradication rate of 75 to 95, while quadruple therapy is around 75 to 90%. So if we talk about the secondary and rescue therapy, so rescue therapy are given to those patients who have failed 2 or more of the treatments, and now we offer them these treatment regimens. The first is the concomitant therapy, in which a proton pump inhibitor, clarithromycin, amoxicillin, and nitronidazole is given each twice daily for 7 to 10 days in place of 10 to 14 days as in the primary treatment. The second base therapy is the levofloxacin, in which triple therapy in addition to sequential therapy and in addition to concomitant therapy. So the primary and the secondary treatment, they're both united and given to the patients. This is given for 10 to 14 days. And then lastly, the rifabutin triple therapy, in which a proton pump inhibitor, amoxicillin, and rifabutin is given each twice daily. This is for almost 14 days. So the duration of levofloxacin-based therapies and rifabutin triple therapy is almost for 2 weeks, while concomitant therapy is for 7 to 10 days. So the eradication rate Because it's a secondary treatment, the eradication rate is relatively lower as compared to the primary treatment. Concomitant therapy has an eradication rate for almost 63 to 95%. Levofloxacin based therapy has an eradication rate usually higher than as compared to the other two for almost 70 to 95%, and the rifabutin triple therapy has an eradication rate for almost 60 to 80%. So the rescue regimen, like I mentioned before, is given to patients who have failed two or more of the treatments. They may consist of an alternate primary treatment. We can also offer those patients with the different primary treatments, for example, the sequential therapy and other therapies. The improved eradication rate compared to standard proton pump inhibitor triple therapy is around 89% versus 77%. For example, if the patient has a first regimen of around 58%, as shown in this graph, the regimen with first and second therapies is around 85%, and if we offer the patient with first, second, and third regimen therapies, the patient might be completely eradicated with H. pylori infection, and the percentage could rise up to 96%. And particularly, clarithromycin resistant bacteria has an eradication rate which goes higher from 29% to up to 89%. So now if we talk about the resistance of antibiotics in patients with H. pylori infection, in the US, resistance to metronidazole and clarithromycin is detected in up to 40% to 11% of the strains. So patients are usually more resistant to metronidazole and clarithromycin antibiotics. The resistance is usually increased with the patient's age. So older patients and middle-aged patients are more prone to resistance to antibiotics, and it is usually more common in women as compared to male. And the antibiotic resistance is usually affects the treatment of the H. pylori infection, which is the basic treatment of the triple therapy. So the recurrence and the reinfection. Reinfection is usually present in patients such as children. In younger age, the reinfection is children are more prone to reinfections. And in adults, in adults who are residing in areas which are very prone to Helicobacter pylori infection, in areas which has a very high prevalence of H. pylori infection. So it includes both reinfection and recrudescence. Recrudescence with a false negative is usually associated with a false negative post-eradication test result at around 6 to 8 weeks. The overall annual recurrence risk is if we talk specifically about the developed countries, it's around 3.4%, and in the developing countries, it's around 8 to 8.7%. So the countries with low socioeconomic statuses are more prone to the risk and the reinfection of H. pylori infection. So lastly, if we talk about the prevalence of H. pylori infection. So as you can see in this world map, the highest prevalence of H. pylori infection is usually in this north of Africa, in Libya and Egypt, and probably in Bangladesh. And around 80 to 90% of H. pylori infection prevalence is around in the south of America and in Russia and India. Other than that, if we talk about the low rate of prevalence around the world, 20 to 30 percentage of prevalence is around Canada and the US and in some parts of the European countries. And lastly, the countries that consist of complete eradication or the lowest prevalence rate of Helicobacter pylori infection are countries within the Western Europe, and Australia is a very is the country top of the world that has a very low rate of prevalence. So if we talk about the summary of this lecture, we've studied about Helicobacter pylori infection and the pathogenesis. How does the Helicobacter pylori infection affect the host or the humans? They are affected by two different methods, which is the bacterial colonization and the response of the host in response to the H. pylori infection. And then we've studied about the different features that the patients present with, and then the different diagnostic techniques such as the non-endoscopic techniques and the endoscopic techniques that can be offered to the patients. And lastly, we've studied about the treatment of H. pylori infection, which is the primary treatment regimens and the secondary treatment regimens, and then what exactly is the rescue therapy that can be offered to H. pylori infection. And lastly, we've studied about the reinfection, the recurrence, the resistance of antibiotics in patients with H. pylori infection, and the prevalence of H. pylori infection. That's all from this lecture. Thank you for watching sqadia.com.